Today we are going to demonstrate the endometrioma, that is also called chocolate cyst. Uh, we will discuss this lesion and its ultrasound finding step by step and one by one. So do stay with me until the end of the video. Dear colleagues, I am Dr. Sultan Ayub, working as a radiologist. Bismillahirrahmanirrahim. Iyaka na'budu wa iyaka nasta'in. Allahumma salli ala Muhammadin wa ala ali Muhammadin wa barik sallam wa sallu alayhi. This is female 38-year-old patient with history of pelvic pain which is intense during the menstrual cycle for the last 1.5 years. So we are going to scan the pelvic region. I have placed the probe above the pubic symphysis and the direction of probe is in transverse direction. Here we can appreciate this lesion. We can appreciate this is a lesion which looked like a solid lesion. But if we closely observe, we can appreciate that this lesion is well defined, almost rounded, and it has thin walls, not too much thick, it is likely a thin walls. And here we can appreciate the internal diffuse low-level echoes which are giving the classical ground glass appearance or like a sand. Here we can appreciate these echoes are completely filling this cystic lesion, and this lesion is giving posterior acoustic enhancement, and this lesion is located at the right adnexal region. So now we are going to see it in a real finding. Now here we should see this is the uterus, and here we can appreciate this one. This is the ovary. So this is the right ovary which is being occupied this lesion. This is the right ovary, and this lesion is occupying the right ovary at its superior aspect. And when we see the uterus is normal looking. And look at the left ovary. This is the shape of the left ovary which is normal looking. So here what we have seen that this lesion is which is having characteristic feature like number one, the well defined smooth walled and thin walled lesion. Number two, it is occupying the right ovary. And number three, it is filled with diffuse low-level internal echoes that is giving classical ground glass appearance. And number four, this lesion is giving posterior acoustic enhancement. Not like this. This is giving shadow. This is the gut loop. So this is the acoustic enhancement. So it look like a solid. but it is not a solid. How we can appreciate? We put the color and then set the TRF up to low level so that we can appreciate the low velocity blood flow, and then increase the color gain. Here we can appreciate that if there is no vascularity within the cystic lesion, within this lesion, no vascularity. So any lesion which has solid component or is solid is always have vascularity. It may be low, but it would have always vascularity. So from this, it is clear that this lesion is not solid from the inside, and its wall are not too much thick. So this type of lesion is which have such characteristic findings is called endometrioma or chocolate cyst. And what is endometrioma and chocolate cyst? When the end tissue that is similar to the endometrium is found or located outside the uterus, and then this tissue may involve any structure like ovary also. So when it involves the ovary, this endometrial like tissue respond to the hormonal change during the menstrual cycle. So with bleeding during the menstrual cycle, the blood also accumulate in this endometrial tissue, ectopic endometrial tissue within the ovary, and then go on accumulating with the many menstrual cycles. So with the passage of time, the blood products which accumulate within the endometrial tissue, this then endometrial tissue adopt the shape of cyst, in which the blood products are filled, and these then blood products undergo degradation, undergo breakdown, even hemoglobin breakdown occurs, and then this products, which are now old blood products, have altered their feature. So due to these thick altered old products which occur due to the degradation of the blood, breakdown of blood, adopt this feature which we call diffuse low level internal echoes, giving the classical ground glass appearance. So this, for this reason, this is called endometrioma. And so keep stay with me. I will then demonstrate the difference between the hemorrhagic cyst and this chocolate cyst or endometrioma. I am now briefly going to tell you that this chocolate cyst or endometrioma will not dissolve itself, because it will go on increasing during each menstrual cycle due to the accumulation of blood products, while the hemorrhagic cyst has tendency to resolve itself. Number two, it has diffuse low-level echoes giving ground glass appearance, completely filling the lumen. While in the hemorrhagic set, there are fibrin strands, echogenic dot line, and these are not completely filling the lumen. This may appear a linear dot lines, fibrin strand that is not present in the chocolate cyst. Number third, the hemorrhagic cyst usually resolve itself, while this will not resolve. And number four, In the chocolate cysts, there will be no retracting clot. Usually, no retracting clot is seen or blood clot is seen within the cyst, while in the hemorrhagic cyst, blood clot, retracting clot can be seen in many times. So these were the differences between the chocolate endometrioma and the hemorrhagic cyst. So I will show, stay with me, I will show the appearance of uh, hemorrhagic cyst from the another patient. Uh, you will see what are the difference between the chocolate cyst and the hemorrhagic cyst. So this was all about the endometrioma and chocolate. So one thing I forgot to tell you why it is called chocolate cyst. So because the breakdown of the hemoglobin and the other products, blood products, the internal material becomes brown like a melted chocolate. When when a surgeon open the uh, chocolate cyst or cyst after excision and open it surgically, this gives a brown colored material which is like a melted chocolate. For this reason, it's called chocolate cyst. So this was all about the chocolate cyst. Inshallah, in the stay with me, I will also put the other video combined with this video to have a differentiation, how to differentiate the chocolate cyst with the hemorrhagic cyst. Another video will be of hemorrhagic cyst of another patient. Thank you very much. Here, this is another patient, female patient with history of pelvic pain, and whenever we are going to scan the pelvic region for some gynae problem, then we should first scan the uterus and then we scan the adnexal region. So here we can appreciate this cyst. This is a cystic lesion, and whenever we uh, appreciate some pelvic pathology, then we should zoom the image so that we have better visualization of the pathology. Here we can appreciate the cyst, and posterior to cyst is the free fluid. So here we can appreciate this one. This is the posterior cul-de-sac region, and this area is the anterior cul-de-sac region. So this fluid is present in the posterior, less likely, but it is at the anterior cul-de-sac. So now, whenever we appreciate the lesion within the pelvic region, we should then differentiate we should scan the ovaries, right-sided and left-sided. So this is on the right adnexal region, cystic lesion, or we can say cyst, and I'm going to see the left adnexal region, and this is the left ovary, this is the follicle, and this is the left ovary, which is looking normal. So now I am going to scan this one. This is the cyst, sorry, this is the right ovary, and this cyst is occupying the right ovary. Now I'm going to zoom the image to have better appreciation, and here we can appreciate, we cannot see it a septation. This is the boundary of the cyst, and this is the free fluid, and this is the pelvic tissue, and this is the boundary of the cyst, which is mildly thick walled, and in the previous cyst we have seen the fluid debris level. Here we can appreciate these internal echoes and slightly linear densities, which we can call dot line, echogenic dot line. So these echoes are the blood products which are settled down at the dependent portion of the posterior wall of the this cyst, and this dot line, which are linear densities, echogenic linear structure, these are the fibrin strand. After the fibrinolysis, these strands may be present within the cyst. So this is likely the hemorrhagic cyst. This is not endometrioma, because the endometrioma should show the low level echoes within the lumen. The lumen should be filled with the low level ground glass appearance. So this is the feature of the endometrioma. While this cyst, which is well defined, well marginated, and having the increased wall thickening mildly, and this is the internal echoes and linear dot line. So this is likely suggestive of the right ovarian hemorrhagic cyst, while this is the free fluid. Sometime we also can see such cyst, which we call it infected cyst. So the infected cyst will also show such findings, but there should be a severe pelvic pain and maybe fever. This patient is not having such a complaint. So again, now I have defreezed the image. We can observe it. So when we appreciate the cyst or lesion, then we should also scan to search the ovary, whether it is para-ovarian, peri-ovarian, adnexal, parapelvic, or ovarian cyst. So we can appreciate this is the fluid which is having the crescent shape. And here we can also appreciate, so this is not, and so this is the ovarian tissue which is at the periphery, while almost whole ovary is covered by the, occupied by the this cystic lesion, which is hemorrhagic cyst. So this is the another shape of the hemorrhagic cyst, another appearance, another shape of the hemorrhagic cyst. So hemorrhagic cyst may present with different orientation, different